And welcome back. Well, we have a guest on today who, if you watched last week, was in one of the segments we did over there at Harvard Eye, but he hasn't been sitting here in our studio that many times, and it's good to have him. Dr. Taymorian, Dr. T, as he likes to be called.
Thank you.
And it's really good to have you here.
I appreciate it. Thanks for having me here.
Yeah, it is. It's a pleasure, and you know, Dr. Hovhannissian kind of let go of his chair this morning for you.
Exactly.
But that's all right. And today you brought along some slides to us. First of all, I know a lot of the doctors over there, you have certain specialties, and what is yours?
My specialty in particular is glaucoma and cataract surgery.
Okay. And while we were over there, I remember you showing me all the different apparatus that you use to test for that. And you brought along some slides today. And I think people hear glaucoma and they think, you know, does this mean that I'm going to lose my sight eventually? Because we've heard that in the past with some celebrities and things like that.
Yeah.
So let's first talk about basically what is glaucoma, how does it form?
Yeah, that's a great question. The interesting thing about glaucoma, it's not really just one disease. It's a combination of already 40 different types of diseases put together. The common end pathway is the same, which is why the treatment options are the same.
Okay.
For one reason or the other, the eye pressure of the eye is too high. And when the eye pressure is too high, it damages the very sensitive nerve in the back part of the eye, the optic nerve. Now, the optic nerve is what the relay center is taking the information from your eye to your brain, so you can then have that option of actually seeing things. When the pressure of the eye is too high, it damages that nerve. And as that nerve gets damaged, you actually lose fibers that transmit that signal. So what do patients notice as you lose more and more fibers? You actually lose your peripheral vision gradually.
Okay.
And that can actually get worse and worse.
Here.
Yeah. And as that gets worse and worse, you can actually then lose your entire vision. But just because you're diagnosed with glaucoma doesn't mean you're necessarily going to go blind. The earlier we can catch glaucoma, but we have a lot of great options to not only slow it, but hopefully actually stop the progression of glaucoma. The biggest challenge with glaucoma treatment is being diagnosed with it first. The difficulty is patients don't notice that they're losing their vision first because it's out in the periphery, so they don't come in to be checked. Unfortunately, by the time they're noticing they're not seeing well, it's already advanced glaucoma, and that makes it very hard to treat. So the best thing you can do is just get annual appointments taken care of, and if there's an issue that could be developed with glaucoma, the sooner you get it treated, the better you do.
Is normal aging, are you going to lose peripheral vision? Like we all know that as you age, you're maybe going to need reading glasses. You're going to lose some of that strong sight you used to have when you were a kid. So is that normal or not?
There's certain entities that are normal to occur. You're going to lose some of those nerve fibers, but it's not normal to lose your peripheral vision due to glaucoma.
Okay. All right. So we got a slide here, and you can see different eye drops here. Are these some of the topical treatments that can be used?
Really the biggest question patients have once we diagnose them with glaucoma, so what are we going to do about it? And there's really three major classes of trying to do that. All of them have the same goal. We want to reduce the pressure within the eye.
Okay.
Each of these have their pluses and minuses, but we can use them together to help our patients. Generally, we start off on the more conservative side, which are just some eye drops. That's what we see here on the top left, and we have multiple options of how to do that. The difficulty with these eye drops are the side effects. Their job is to bring the pressure down, but they can cause redness and irritation. And there's other issues of actually having to get the drops. There's a cost issue, having to remember to put them in, and actually having to get them into the eye, which can be a challenge for certain patients.
Yeah, I can imagine
On the
that. Yeah.
other end of the spectrum, we have surgical procedures. Those surgical procedures, they do a great job of bringing the pressure down, but now we're talking about actually surgery on the eye. And with that comes risks of bleeding, infection, or other issues that can come up. A happy choice somewhere in the middle is our laser procedure, which can do a good job of bringing the pressure down without the risk of bleeding or infection. So what we generally do is, depending on where the patient is in their stage of the disease, again, one of the issues is trying to figure out where they are. We can then use one or more of these treatment options to help our patients out.
Okay. You talked about what is glaucoma. Are there causes to it that are known and that can be avoided? Is it maybe an effect of having other diseases or medications you have to take?
Sure. The most common types of glaucoma, there's actually really no good underlying reason. It's just that the natural drainage system within the eye gets more and more plugged. The way I think
Okay.
about it is like the faucet and drain at your house. The faucet is always on because your eye's always creating a pressure or creating a fluid, but the drainage system clogs up naturally as you get older. And,
Okay.
And as it gets more clogged up, the fluid builds up, the pressure builds up, and then that's what damages the nerve. Now, there are certain things that can cause glaucoma. Remember, there's over 40 types of glaucoma. Certain medications can cause it if you respond that way, like steroid medications.
Okay.
It doesn't necessarily mean that if you're using steroids, your eye pressure will go up, but for certain people, they're very sensitive to that. There are also other types of glaucoma that can be caused by certain diseases that are very rare, such as infections in the eye, inflammation in the eye, cancers in the eye, or other issues that can come up. But that's a significant smaller portion than what we normally see.
Okay, and the selective laser, is this something that you were just talking about? Does it go in and unplug that drain, basically?
That's a great way of thinking about it. So this laser that we're talking about is called a selective laser trabeculoplasty, but we just abbreviate it to SLT. The idea of the SLT is we want a safe way to bring the pressure down without causing any issues. What this laser does, it actually applies very short, low energy light pulses to the natural drainage system of the eye, that drain that we were talking about.
Okay.
Your body actually senses the laser and actually does the cleaning for us. And that's what makes the laser really nice to do. There's no real cutting with this laser, unlike the other lasers that we deal with. So there's no issues of bleeding or infection.
Oh, that's
it's your
good.
body actually doing the work for us. It just needs a little signal saying, hey, could you come clean this up for us a little bit?
Okay. If someone elects to do this and you think it's the right option, how often is this done?
That's a great question. For most people, it lasts about 2 to 3 years. And
Oh, wow.
And it's the equivalent of one drop. So there's many different applications of when we can use this laser. If you think about the whole spectrum of glaucoma, we have patients that are very early that we're deciding you do have glaucoma and you need to be on some kind of a treatment option. Certain patients will say, I'd rather not use a drop. Is there anything else we can do? I have an issue with cost, or I have an issue with remembering, I have an issue of actually executing and getting the drop
Sure.
in the eye. This would be a great option to do. Then there's a middle section of glaucoma treatment where the patient may already be on some medications, but their glaucoma is getting worse. So what do we do in that case? They don't necessarily want to go ahead and do the surgery because of the risk. This is a good way of augmenting that. Then we have patients who unfortunately have already had glaucoma surgery, but they still need their pressures to come down, and that actually does still exist. This is another way of bringing the pressure down too. So no matter where you are on the spectrum of disease, this is an option that would be worthwhile to talk about. And it applies for most of those 40 types of glaucoma that we talked about.
Okay. What should patients expect when they are going in to have this treatment, and anything afterwards? So they have to put a patch on their eye or anything like that?
Great question. Again, the best part about this treatment option, there's no cutting involved. You come into the office, we put some eye drops in that help us with the laser. So you just sit for about 20 minutes. The laser procedure actually takes a minute or two to do. You then take a seat outside again for another 15, 20 minutes or so. We check your pressure, and you're on your way home.
Wow.
Because
it's a great option, it sounds like.
it is, because there's no cutting involved, there's no antibiotic drops, there's no additional steroid medications that I would give. Patients always ask me, can I read or can I watch TV? Perfectly fine to do that. In fact, you can do whatever activities you feel comfortable doing. I always tell my patients, if you want to go swim, you can go ahead and swim. There's nothing you're going to do to damage the eye. Now we let nature do its thing and let it actually work in the eye. The only thing you need to do is just continue doing what you've been doing before and keep your follow-up appointment.
All right, that is good news. And when I was taking the tour over there at Harvard Eye, what really I was seeing, in that both you talked about when we were there, and all the other doctors and the specialists, is the advancement in all kinds of eye treatments. The fact that we have this laser is just amazing. It's only going to get better. And that's what's really nice about it. And it's to control glaucoma, and maybe one day there's going to be something there to just totally reverse it.
We
which would
hope
be
so, and that's what we're working on, and we're very encouraged by the research coming out, and we're always looking to more technologies to better serve our patients. So I think every day we get a little bit closer to where we want to be.
Yeah, I think you do too. Dr. T, thank you very much. It's been a pleasure.
Thank you so
You
much.
have to come by a little bit more often.
I appreciate it. Thank you
All
for
right,
having me on.
if Dr. Hovanesian will let you in. We'll talk to him about that. All right, hey, you take care and thank
Thank you so much.
We'll be right back.